I've been running for 48 years. And as a runner, the first thing you do is check the weather. Is it raining outside? Is there snow and ice? Today, I'm not checking for rain and snow and ice. I'm checking for air quality.
Although the air has improved much over the last couple of years, we still have a pretty heavy burden of air pollution compared to other places in the country.
When the air gets pretty bad, my heart goes into AFib. And sometimes if the air is bad for days, it goes into AFib for days.
Air quality is probably the most controversial thing that we have going on in our neighborhood.
For me, it's killing me.
It's a false choice to say we can have this type of industry and the jobs associated with it, or we can have a healthy environment and healthy people. We believe we can have both.
It's worth being here and fighting for clean air. It's a beautiful city. It's a place that I love.
Historically, the air quality issues in Pittsburgh, you could qualify them as severe.
It was a grim city, a city you could taste in your mouth, a city that smarted in your eyes.
If you go back to the 1940s and 1950s, life expectancy, particularly for people who worked in industrial facilities, wasn't much above 50, 55 years old. And there's a lot of cases of heart disease and respiratory disease and cancer. At that time, people were still burning coal in their fireplaces. Steam and locomotives, let alone the industrial facilities, use of coal without having pollution controls was a big problem for air in our region. In the 1940s, after the Donora smog inversion event that killed many people, I think that event was really embarrassing for leadership in the region. So there was a coming together on the part of industrialists and regional political leadership to tackle the pollution issue. The Pittsburgh region, Allegheny County, and the state of Pennsylvania were some of the first places that started passing laws and regulations to improve air quality.
I think most people, when they do go outside on a day like today, find it hard to believe that there's a problem. Air pollution is a particular problem in southwest Pennsylvania for a variety of factors. One is that although you don't see some of the industrialization that you once did, a little further down the river, you still continue to have major industrial facilities, steel mills, coke plants that continue to produce a lot of pollution. Like any urban center, we have many motor vehicles. Those motor vehicles tend to be concentrated in low-lying river valleys, as other modes of transportation, such as railroads, as well as the barges that go up and down the river.
The problem is that pollution doesn't go anywhere because we have these valleys and then we have a complex terrain. We have the river valleys and deep valleys, and we have what's called air inversions. Air inversions, when the air is warmer above than it is on the ground. Well, the sun doesn't hit those valleys, so it stays cold there. That traps pollution. It creates a lid. And so that pollution just keeps building up and building up and building up, and that causes health problems.
Things have improved dramatically over the last 5 decades, but the air here in Allegheny County and really in southwestern Pennsylvania still is some of the worst in the nation, especially with regards to fine particulates that come from a variety of sources, from everything from the tailpipe of a diesel truck to a coal-fired power plant to a coke-making facility to someone burning something in their backyard.
If you're exposed to air pollution, you can breathe in very small particles called PM 2.5. They're very tiny.
Those particles are small enough to go past your respiratory defense systems and go right into your lungs and directly into your bloodstream, where they can pass around through your body.
The biggest pollution source in this area is going to be the Clairton Coke Works. But what comes from Clairton Coke Works is primary. I mean, that piece of soot comes right out of that stack and is picked up by that monitor, it goes into your lungs. And that piece of soot coming from a coke operation has a lot of toxics in it.
People who live in closer proximity to industrial facilities, particularly in the direction of the prevailing wind, are the people who have the most health issues related to air pollution. When the Clairton Coke Works had an explosion and a fire that took offline all of their pollution control equipment, people were complaining about the smell and having trouble breathing there. There were multiple public hearings that were taking place on that topic, with people essentially wanting U.S. Steel to shut down the Clairton Coke Works.
I was being poisoned by the Coke Works. This helped me to breathe. It stops my heart from palpitating. I went back for my brother's funeral back to Seattle in 2016, and I was there for 11 days. And all of the pills prescriptions that I was taking while I was here, I didn't need it anymore while I was there. My head was clear.
In December, it was so bad out here, it looked like Armageddon outside.
He was very young when he contracted asthma, and he's had asthma really bad.
And I've done a lot of work with the children and the communities around here looking at air pollution impacts on asthma. There are many triggers of that: allergies, respiratory infections, tobacco smoke, air pollution. We know in general more boys have asthma than girls. African Americans are more at risk, and we know that patients who are poorer are more at risk.
I use my inhaler mostly on very bad days, but not all the time.
How does it impact us? You know, environmental racism, environmental justice, it's something that is an everyday reality for us. The folks who were the least privileged, the folks who were not able to get, the best jobs, the pensions, the benefits, the health care, those type of things, those are the folks who are still here.
We moved in 2004 to take a job in New York City. Lived in the middle of Manhattan. I ran every day in Central Park. I never had a day when I couldn't run because of bad air. When we came back to Pittsburgh, we decided to live in the city rather than the suburbs. And that was the first day that I noticed, whoa, something's wrong here. This smells bad. I'm a convener of a group called East End Neighbors concerned about air pollution. I believe grassroots groups can be effective. Just recently, we had a rally down at the city-county building right in advance of a meeting of the Allegheny County Health Department Board. I believe that we've caught their attention.
I'm not just angry today, and I am not just angry alone.
The weather today is a little bit cloudy. Air is pretty good. Well, actually, it's kind of in the yellow range. I'm working on a documentary about our region's air quality called Inversions, the unfinished business of Pittsburgh's air. I've been focused on environmental issues as a filmmaker and activist since about 2006.
Back with the scroll of Smell Pittsburgh here, the over 11,000 complaints submitted since the beginning of the Smell Pittsburgh app.
Now we have tools, monitors, apps where we can see each other's complaints that show us that A, we're not alone in our concern for air quality, and B, our lived experience is reflected in monitors that change in real time that we can see. When the air stinks outside, the monitors are spiking.
We have regulations that are much more stringent than the federal government or the state for Clairton, and we have inspectors out there every day, some evenings and even on weekends. Industry doesn't like me because the efforts of the health department cost them money. And certain parts of the public don't like our efforts because it's not enough. We can't just order someone to reduce emissions or order someone to shut down, because then that gets appealed and appealed and appealed. Everybody in Allegheny County deserves clean air. Some people we have to fight a little bit harder for, especially over in the Mon Valley.
We live here. You need to be out here fighting for your ear.